It's good to be back with all of you. Each week throughout the semester, I've provided a presentation on different elements of the pandemic and our response here at Georgetown. In this presentation, I'll share with you some important updates on the recent rise of positive cases of COVID-19 in our community. We track a set of metrics on the pandemic. We follow closely the number of positive tests and the overall positivity rate at Georgetown and in our region. Testing is one element of our layered public health program. At Georgetown, we conduct around 5,000 tests per week. For most of the semester, our positivity rate has remained at or below 1%. We've seen about 25 cases per week, with as many as 46 during 1 week in early September and as few as 11 in late September. We have been testing roughly 10% of our community each week as part of a surveillance testing program to monitor disease activity in our community. This 10% is randomly selected each week. In addition, some of our special populations, for example, our child care workers or our students engaged in intercollegiate athletics, are tested regularly. Our students in intercollegiate athletics also adhere to an additional set of COVID-19 protocols as part of their participation in our athletic teams. More than 97% of our community on our campuses is vaccinated. For the small number of individuals who have medical or religious exemptions, we require twice-weekly testing. We test anyone with symptoms. We test close contacts identified as part of our contact tracing process. We have a process set up through an online check-in survey where anyone in our community can indicate that they are experiencing symptoms and can engage our Care Navigator team for support and information. Anyone in our community who wishes to test at any time can receive one, and appointments are available daily at multiple sites on our campuses. We use the gold standard in testing, the Pcr test. False positives from a Pcr test are extremely rare. Last week, we began to see a sharp increase in the number of people testing positive for COVID-19. Over a 48-hour period, we saw more than 40 positive tests, our highest two-day number since January of this year. With this rise in cases this past week, we asked all of our undergraduate students to take a COVID-19 test. I'll talk a little bit more about this in a moment when I describe the additional steps we have put in place. Over the past 2 days, we have continued to see a high number of cases. I'll share with you what we know about these cases and then describe some of the steps we have taken to respond. First, what do we know about this current rise in cases? Most of the positive cases are among undergraduate students. 40% of those who tested positive indicated no symptoms at the time of their positive test. The rest had mild symptoms. This is consistent with national trends for vaccinated people. Whenever a person tests positive, we begin a process of tracing their close contacts to determine who may have been in close proximity to them in the 48 hours prior to their positive test or onset of symptoms. Our Care Navigator team conducts the contact tracing process. Our contact tracing has identified multiple small clusters of people connected by social gatherings and activities. We have found no examples of transmission in the classroom. If a person tests positive, it is important that they isolate themselves for 10 days. This test, trace, isolation process is important because even if someone is asymptomatic, even if someone is vaccinated, it is still possible for them to transmit the virus to other people. Given the evidence about how people get infected, isolation is an expectation of our local health department, the DC Department of Health, based on CDC guidelines. We are working closely with DC Health on these cases. Isolation cuts the chain of transmission from person to person. This is especially important in places like schools, which are known as congregate settings, where people live, work, and spend time together in close proximity, and viruses are more likely to spread quickly. Over the course of the pandemic, the CDC has adjusted the number of days that someone is expected to isolate from 14 days to 10 days, their current recommendation. 10 days is the average duration an infected person can remain infectious, though some people can remain infectious for longer periods. Isolation is counted from the date that a test turns positive in an asymptomatic person or the date of onset of symptoms in a symptomatic person, whichever happens first. The CDC is continuing to study this issue, and we could see updated recommendations in the future. Right now, however, the requirement remains 10 days. We provide isolation space for students living on our campuses, and as I have shared with you, our care navigators work with our students to provide resources and services from meal delivery to information about wellness and mental health. I'll turn now to our response this past week. On Thursday, when we notified our community about this increase in cases, we announced a series of steps and reminders regarding public health. All undergraduates are expected to receive a COVID-19 test. These are available at multiple locations on our campuses. We encouraged all tests to be scheduled between Thursday through Saturday of this past week. We extended hours and the number of appointments at our testing sites. All members of our community are encouraged to monitor their symptoms and to stay home if they have symptoms, and to indicate any symptoms on our COVID-19 check-in survey. We have reduced density in our dining halls and are offering more grab-and-go options at all of our dining facilities. And we are encouraging students to use the grab-and-go option as much as possible during this period. We are restricting food in public lounges at this point, another temporary measure to ensure people are wearing masks as much as possible in public spaces. We are encouraging events to be held outdoors and for social gatherings to be limited in size. Our public health ambassadors are helping to support our indoor mask requirement and reminding everyone to wear a mask indoors. Recently, on October 18th, we also announced a new policy on events and visitors. We are requiring all visitors to Georgetown buildings to be vaccinated. Over the past few months, we have held as many gatherings outside as possible in tents that we have set up around campus. Children who are not yet eligible for vaccination and those who indicate a medical or religious exemption from vaccine requirements must provide proof of a negative test within 72 hours before coming to our campuses. We made this decision to require vaccination for visitors anticipating that more activities will be held indoors as we enter the winter months. Throughout the pandemic, we have been tracking the experiences of peer institutions. We have seen that when other institutions have faced a rise in cases on their campuses, they have taken steps similar to these, reducing density in dining and social spaces, limiting events and activities. On some occasions, our peers have moved temporarily to virtual learning based on the specific circumstances they were experiencing within their communities. We are monitoring this situation closely and will continue to provide updates to our community in the coming days. I hope that this has provided you with a sense of the current context and the steps we are taking to respond. We will continue to keep our community updated as this situation evolves. Thank you all for joining me today. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.